Drugs in Mountain Rescue by John White. UK Mountain Rescue Team members who hold a current casualty care certificate can administer drugs to casualties. The drugs must be used as described in the Mountain Rescue England and Wales Drugs Formulary 2017-20. This presentation must be used in conjunction with the drugs formulary. When administering a drug, always check the following: the drug name and indication, the presence of known allergy or significant contraindication, the drug strength and dose, the expiry date. Always record drug administration, which should include the name of the drug, the dose and route given, time of administration, and the name of the casualty carer administering the drug. Medical conditions where drugs can be used include myocardial infarction or heart attack, diabetes, exhaustion hypothermia, anaphylaxis, asthma, fitting from epilepsy or traumatic brain injury, wound infection, nausea and vomiting, and pain. In a myocardial infarction or heart attack, it can be treated with aspirin, glycerol trinitrate spray, and analgesia, which is usually morphine, so also you need to consider prochlorperazine for nausea and the need to have naloxone, the antidote to morphine, readily available. Aspirin is usually a single tablet, dissolvable or chewable. It's given to adults only. It should never be used under the age of 16 years. But don't give it if there's an allergy to aspirin or other anti-inflammatory medications such as ibuprofen, or if the casualty has already taken 300 milligrams of aspirin that day. But do give if they have only taken the baby 75 milligram aspirin. Glycerol trinitrate or GTN spray is a metered dose spray given under the tongue, must only be given to adults, and do not give to children or clinically shot casualty with a systolic blood pressure of less than 90. Morphine. Mountain Rescue casualty carers should administer this intramuscularly, and a pain score must be obtained prior to giving it. Do not give morphine if there's an allergy or hypersensitivity, if there's respiratory depression, if the casualty is clinically shocked, or if they have a head injury with a GCS of less than 11 or U on the AVPU scale. Prochlorperazine or Bucostem can be considered for nausea caused by the morphine. The tablet is administered by placing it between the upper lip and the gum and allowing it to dissolve. Do not give this to children and use cautiously in the elderly. Naloxone reverses the effects of morphine, particularly when accidentally given too much. It's administered by an intramuscular injection. It should be used if morphine or a similar drug has caused a respiratory rate of less than 10 breaths per minute, or the casualty cannot maintain their airway, or the casualty is unconscious with a GCS of less than 10 or U on the AVPU scale. Diabetes can be treated with oral glucose, for example glucogel. This is administered as a gel rubbed onto the gums and the inside of the cheek. It's used when low blood sugar or hypoglycemia is considered in a diabetic. There are no exclusion criteria. Oral glucose can also be used in exhaustion hypothermia. The same criteria apply. In anaphylaxis, the drug used is adrenaline. This is administered for life-threatening allergic reactions. It's administered intramuscularly, either from an ampoule or an auto-injector such as EpiPen. There are no exclusion criteria. Asthma is treated with salbutamol and ipratropium bromide. And note that these drugs can be used together. Salbutamol is administered as a liquid from a nebule or a plastic container using an appropriate face mask connected to an oxygen cylinder. It can be given to a casualty of any age with appropriate dose adjustment. There are no exclusion criteria, or it can be administered using standard inhaler via a spacer device. Ipratropium bromide is also administered from a nebule in the same way as the salbutamol. There are also no exclusion criteria. In a fitting casualty, the drug used is midazolam, and this is used for either an epileptic fit or a fit immediately after traumatic brain injury. The solution is administered either intranasally via an atomizer or via the oromucosal route. It can be administered to adults or children with appropriate dose adjustment, and there is no exclusion criteria. A contaminated wound is treated with an antibiotic called cefuroxime. So it's administered for major contaminated wounds with or without a fracture, or an open fracture more than 1 hour from the hospital to the hospital from the time of injury. It's administered by tablets orally, given to adults only, and shouldn't be given if the casualty is allergic to penicillin or other cephalosporin antibiotics, or to children. Nausea or vomiting is treated with prochlorperazine or bucostem, and it can be considered use for nausea or vomiting from any cause, such as stretcher carry, gastroenteritis, and the side effects of morphine. It's a tablet administered by placing it between the upper lip and gum and allowed to dissolve. It should not be given to children and should be used cautiously in the elderly. Pain can be treated with an appropriate combination of morphine, Entonox, paracetamol, and ibuprofen. Morphine can be administered by MREW casualty carers intramuscularly. A pain score must be obtained prior to administration, and do not give morphine if the casualty has allergy or hypersensitivity to morphine, has respiratory depression, is clinically shocked, or has a head injury with a GCS of less than 11 or U on the AVPU scale. Entonox is self-administered gas in a blue cylinder. It can be used for adults and children if they are able to self-administer. Should not be used if the patient is unable to hold the mask and self-administer, if the patient has a head injury with decreased level of consciousness, if there's a possible pneumothorax, or if the patient has been diving in the past 24 hours. Paracetamol are tablets given orally, can be used for adults and children from 6 years and over with appropriate dose adjustment, and they should not be given if there's an allergy to paracetamol. Ibuprofen is a tablet taken orally. It can be used for adults and children aged 7 years and over with appropriate dose adjustment. Do not give if there's an allergy to anti-inflammatory drugs, including aspirin, a shocked trauma casualty, known kidney disease, severe dehydration, history of bleeding ulcer in the gut or regular indigestion, or if the casualty is pregnant. Oxygen is an inhaled gas in a black and white cylinder, and it can be considered for administration to all seriously injured or ill patients and those with abnormal vital signs or reduced conscious level. It can be used for adults and children. If oxygen saturation can be measured reliably, then consider not using it if the casualty has a heart attack or chest pain with a saturation over 94%, a stroke with a saturation over 94%, or heat exhaustion.